Welcome to the show. I'm Kathy Ireland. We all know how important an annual veterinary checkup is for our pets, but sometimes, just as people do, an ill or injured animal needs a specialist care. Gina Del Vecchio, CEO of Sage Veterinary Centers, and Dr. Wendy Villando Rankin, Chief Medical Officer, join us today to talk about their company's emergency and specialty veterinary care. Welcome.
Thank you. Thank you so much. We're really excited to be here.
Now, Wendy, what types of medical specialties are available at Sage?
Well, if you think of a human hospital and the specialties that they have in any human hospital, you can probably find that equivalent specialty in any Sage hospital. We have internal medicine, surgery, emergency critical care, my favorite, oncology. We also have neurology and cardiology. There are 12 specialties currently at Sage, but we're growing and there's going to be more after that. The nice thing about all of our specialties is that you can come to one location and have your pet taken care of from a whole body perspective.
Now, Gina, could you please tell us about Sage Veterinary Centers and its mission?
Sage Veterinary Centers is the largest specialty group on the West Coast and one of the largest in the country. Because of the density of our super hospitals and the number of specialties that we have together, our vision is to really create an end-to-end experience for our clients. Wendy mentioned the urgent care that we're doing, and that's really a direct action that we're taking to create more capacity so that if you're coming into the emergency room for a true emergency, you're served faster. Urgent care is a little more scheduled. The idea is to be a technically enabled one-stop institution where we're actively doing clinical trials, particularly in the oncology space. Wendy's team leads that. We are rigorous in our learning and development, so there's an academic component. And then, of course, the quality of the clinical medicine.
One mission that is prevalent throughout all the Sage hospitals, particularly on the clinical floor with the clinical staff and the doctors, is that we want to make sure the medicine for the patient is the best that it can be, whether that means us participating in as many continuing education opportunities that we can, or training our clinical staff as frequently as we can. That focus on the medicine is really one of our core values on the clinical floor.
Mm-hmm. As a teaching institution, I will add that our symposium, which happens in the spring of every year, is one of the most well-attended events. People really look forward to it, and all of the clinicians are doing continuing education all the time. So we do tracks on various specialties, areas of interest. We're starting to integrate some education around business because veterinary practice owners are being approached by companies like ours to join. What does that mean? What should I do with my business? And so we feel the obligation to really invest in the education of the space.
As a leader in animal care, Sage Veterinary Centers is dedicated to providing continuing education for veterinarians of all specialties and interests. The annual Sage Symposium presents learning topics for hundreds of veterinarians, technicians, and practice managers who want to stay on top of the latest developments in animal medicine.
The Sage Symposium is in its 20th year, and when we first started the event, what we wanted to do was give back a high level of expertise in continuing education, or CE, to the veterinarians in the Bay Area. One of the other things that I think is special about it is that we're able to give this world-class CE to veterinary technicians, which don't often have a lot of opportunity to get CE at a reasonable price. The sponsors are also a really important part of the symposium because we bring them a large number of attendees in a much more intimate environment than they generally see at some of the national conferences. And so the vendors can really spend some quality time with the attendees. And another piece of the symposium that we've maintained throughout the 20 years is a sit-down lunch for all attendees. And today we're seating close to 900 people in one room. And why that's important is because our world is tiny, and a lot of people have gone from one practice to another, or have worked with certain people throughout their career, and they all get to say hi and catch up. So really the symposium is an all-encompassing community event.
What we like about being a part of the Sage Symposium is the fact that a lot of it's local representation. There are a lot of veterinary conferences throughout the US, and you're going to get attendees from all locations across the U.S. Our company, being a regional California company and very strong in the Bay Area, being a part of the SAGE Symposium offers us the opportunity to see those clients and customers that we work very closely with throughout the year.
So SAGE has been incredibly important for us. The partnership's been amazing. They are very supportive of our products as well as our future innovation. So it's important for us not only from a product standpoint, but to also support them, in terms of what SAGE has impacted in the local community as well. So it's been a great partnership.
The SAGE mission statement is to set the highest standard of compassionate and collaborative veterinary care that improves the lives of pets and people, and I get to experience that every day. You're oftentimes not just treating the pet, but you're treating and helping the people that whose lives this pet touches. For me, the people that are in this industry are very special and caring as well, and so for me to be able to help care for them, it really brings the mission to life.
And Wendy, how does a pet owner know when it's time to consult a specialist?
There are a variety of ways the pet owner can know if it's things like where your pet needs certain diagnostics that are available with SAGE. CT scan for diagnosing lung masses or looking at lung masses better. MRI to diagnose brain disease or spinal disease. Echocardiology to look at the heart with an ultrasound, or an ultrasound of the belly to look at several organs to try to find out what's happening in the abdomen. Those are some of the ways that a pet owner may know that they need to come to SAGE. One of the other ways is if they need 24/7 care, if their primary veterinarian is not open on the holidays. Pet owners can come to us specifically because their primary veterinarian is not open and they need to come in. One of the other ways that a pet owner may know they need to come to SAGE is that if there is a special treatment that their pet needs, like repair of a cruciate ligament rupture. Our surgeons are board certified, trained to do that every day, all day. They can do it with their extensive training, and then our clinical staff is also trained in that regard to take care of that patient post-operatively for 24 hours after it recovers from surgery. And then we do the follow-up rechecks until your dog is walking again. So it's our staff and our doctors are highly trained to deal with certain diseases that are very specific to your pet.
Excellent. And Gina, can you talk about the SAGE Veterinary Center's offices and locations?
Absolutely. Our 6 hospitals are in Northern California. We have 1 in San Francisco proper, 2 in the Eastern Corridor, and 3 now on the peninsula. We flank Silicon Valley, and so we have kind of superstar clients, if you will, that are very the technology giants that expect a certain kind of experience technologically when they come in. At this point, SAGE is known for the quality of the medicine. It's table stakes in our business. Our clients know that when they come in, they're going to get the best of the best. And we have very modern facilities. Sustainability is a big focus for us. You'll find safe, clean, comfortable accommodations for pets and our clients. More importantly, you'll find a very elegant workflow, safety, and a great work environment. It's very important for our team as well.
So SAGE is doing all kinds of new treatments or cutting edge, depending on what specialty you're in. But I think as an internist, we're offering a lot of minimally invasive kind of treatments. So that just means from a client perspective that your pet's gonna recover much quicker. So we can stent things now without doing any kind of surgery. We can get bladder stones out without surgery. The surgeons are also doing a lot of minimally invasive things with scopes, and it just makes it so much easier for the pet to recover. The oncology team is probably, at least I'm impressed by what they're doing. They're in clinical trials and working, using vaccines to help delay cancer recurrence, and working with companies to use different drugs. So there's all kinds of new stuff going on and new techniques coming out, and they're kind of being tried throughout all of SAGE. Different people are even kind of subspecializing to some degree to be able to do those.
I joined the practice in 1997 for a very specific reason, and to me it actually remains the primary focus of SAGE, and it's all about the people. We bring together the best doctors in the variety of specialties and emergency that we support, but it's not just their expertise, it's how they work together collaboratively. And it's not just the doctors, it's the entire staff, from the clinical staff that support them in the day in, day out clinical work, but also the management and other support teams. And with SAGE focusing on being able to bring the best people together and then also supporting them to do some very difficult work, we can provide the best medicine to patients in the Bay Area and also a great place to work.
Excellent. And Gina, what can people and their pets expect when they walk into the door of SAGE Veterinary Centers?
You know, the number one thing that our pet parents can expect when they walk in the door is our unwavering commitment to the quality and compassion that we are showing the pet. Right? You know, the pet is nervous, it doesn't feel well, that's an emotional experience for the pet parent. And we do a lot of training with our staff in terms of compassionate conversations. Some conversations are very difficult. The conditions can be time sensitive. People need time to process and really decide what the best path for their pet is in their life. And so we put a tremendous emphasis on the client experience, if you will, which is of course second to the pet care. And our commitment, one of the things that's been just inspiring for me is seeing compassion and empathy and engagement just far beyond what you might have imagined. And it's so inspiring to watch it. Every one of the lives is important. Even in the process of sending one of our companion animals over to the Rainbow Bridge, every time, every day, every clinician is upset. Takes a little piece of their heart. They're never jaded or cynical in any way. So we're really, really proud of that, and we work on it. The SAGE leads with the heart.
Oh, that's excellent. Do you have any plans of expanding SAGE Veterinary Centers outside of the Bay Area?
Absolutely. Today we are dominant in Northern California. We're actively talking to practices in 8 states in the Western United States. And our strategy is really about having a very, very solid core base that we can then extend satellites out from that base around the country. A strategy that's happening in the veterinary space right now is more or less to kind of put pins on the map, just have a lot of hospitals and a lot of staff, which is great, but it doesn't really get to that core of that collaborative power that happens in our super centers. So we're actively looking to expand across the nation.
Excellent. Well, Gina and Wendy, it sounds like SAGE Veterinary Centers offer cutting-edge medical care for pets in the Bay Area. You're leaders, and it was wonderful to spend time with you. Thank you.
Thank you.
Really, really nice to be here. Thanks for having us.
Oh, thank you. And thank you for watching. I'm Kathy Ireland.